Hello everyone. In this video, we are going to demonstrate a very important kinesiotaping technique that can be utilized by physiotherapists to successfully treat shoulder pain problems. Now, this technique which we are going to demonstrate is going to be effective in those patients who report significant benefit and improvement after 4-point correction and posterolateral shoulder MWM mobilization technique. So, the taping is going to help the therapist in maintaining the gleno-humeral joint correction after the treatment is over and is going to help the patient recover faster. So to apply the kinesiotaping for this technique, we are going to use 2 eye strips, and these eye strips are going to be placed right over and medially to the humeral head, and after attaching the anchor, the therapist is going to apply a posterior glide to the humeral head, and then with the 50% stretch is going to apply the tape, and which is going to go posteriorly and towards the inferior angle of the scapula. And the second tape is going to reinforce the correction that we have achieved with the first tape. So let's get started with the practical demonstration of this technique. So tear the eye strip from one end to create the anchor first. And then after removing the paper backing with no tension, we are going to apply this over and medial to the humeral head in this manner. And after rubbing the anchor to activate the adhesive, we are going to remove the rest of the paper backing. And now what the therapist is going to do is, the therapist is going to stabilize the anchor and then is going to push the humeral head posteriorly. Remember that we should not apply too much tension over the skin around the shoulder with the tape itself, as the skin here is sensitive to break down. And now, after delivering this posterior glide, we are going to apply around 50% stretch to the, so this is 100%. We are going to back up by 50%. We are going to apply this 50% stretch, and we are going to take the tape posteriorly and towards the inferior angle of the scapula. And the last part of the tape is again going to go with no stretch. The second tape is going to reinforce the first tape, and we are going to overlap the second tape over the first tape by 50%. So again, we are going to anchor with no tension, rub the anchor, and then remove the paper backing. And then again, after stabilizing the anchor, we are going to push the humeral head posteriorly and then apply 50% stretch, 100%, back up by 50% to the tape, and then we are going to take it while overlapping it with the first tape, and then again at the end with no stretch, we are going to apply the remaining part of the tape. Whole tape needs to be rubbed to activate the glue, and this is how we are going to maintain the gleno-humeral correction which we have achieved with the 4-point correction technique. Do try this very simple and effective taping technique and provide us your valuable feedback. So see you all in our next video. Till then, keep learning, keep sharing, and stay connected.